Imagine you are just taking a walk and someone collapses right in front of you. With no doctors around, would you know what to do in next 60 seconds? Welcome to Dr. Nancy's classes. In this video, we will learn step by step how to perform basic life support. Watch till the end as it might save someone's life someday. Step 1. Scene safety. So you see a person collapse right in front of you, or you see someone lying unconscious on the road or at home. First step is to ensure the surrounding is safe, like watch out for any moving traffic, any loose electrical wires, wet floor near electricity, any fire or gas leak. Bring the victim to a safe place. Remember, before touching any victim, pause for 2 seconds and ask yourself, is this safe for me? You don't jump into the water to save a drowning person if you don't know how to swim. Simple as that. Ask for help. Make sure you are safe while you resuscitate. So now you have brought the victim to a safe place away from danger. Place him on a firm, flat surface. If the victim is on chair or sofa, place him on the floor carefully. Step 2. Check for response. Once the victim is shifted to a safe place, immediately check for response. Remember, time is important. Tap on the shoulder and ask loudly, "Hey, are you okay?" If the victim responds well and good, put him in lateral position, call for help or ambulance, and shift him to the nearest hospital. But if no response, shout for help. Tell people nearby to call ambulance. Step 3. While help is on the way, check if the victim is breathing or not by seeing the chest and abdomen movement, simultaneously palpating the carotid pulse. To check the pulse, touch the thyroid cartilage or the Adam's apple, which is on the front of the neck in the midline. You will feel a hard bony structure. Slightly move your fingers laterally and you will feel the carotid pulse. This should be done within 10 seconds. If there is no pulse, this means there is cardiac arrest. Checking carotid pulse on one side is enough. Remember, time is important. Each second counts. If you can't palpate within 10 seconds, consider it to be absent. Step 4. If pulse is present but the victim is not breathing or breathing abnormally, give mouth-to-mouth rescue breaths. Each breath over 1 second, repeating every 5 seconds. That is 12 breaths in 1 minute. Reassess pulse after every 2 minutes. Shift patient to hospital once help arrives. If there is no pulse, immediately start chest compression. Do not delay. How to give proper chest compression. These are the points that you should remember. Make sure victim is lying on a flat and hard surface. Sit on your knees in the left or right side of the victim. If this is the chest, the middle bone is called the sternum. Palpate from your fingers of one hand the lower border called the xiphisternum. Just 2 fingers above the xiphisternum is the site for chest compression. Put the heel of one hand onto the side and put the other hand on the top of the first hand and interlock the fingers. Your elbow should be straight and the force should be from your upper body, not your hand. Chest compression depth should be 5 to 6 cm. Allow the chest to rise up after each compression before you do the next compression. 30 compressions should be done in 15 seconds, which makes one cycle. After that, give 2 breaths. Then start the cycle again. 30 compression and 2 breaths until the help arrives or for at least 5 cycles. Now let's revise. Number 1. Check for the scene safety and bring the victim to a safe place. Put him on a hard flat surface away from danger. Number 2. Tap on the shoulder and ask loudly, "Hey, are you okay?" and check for response. Number 3. Shout for help. Number 4. Check if the victim is breathing and simultaneously check for carotid pulse. Number 5. If pulse is present and no breathing, give mouth-to-mouth breath. Number 6. If pulse is absent, immediately start chest compression. Remember, once you and victim are in a safe place, do not delay in performing the remaining steps. The earlier the victim receives CPR, there is more chances of survival. I hope this video was helpful. Remember all these steps and you might save someone's life one day.